Welcome to another episode of the Ivy League. I'm your host, Jazz. We got another special episode. We got a couple brothers here. We're going to focus on males in nursing, specifically black males in nursing. So I had to bring a few of my fellas here. So fellas, go around, say your name, the league you part of.
Go first. Timothy Ellsbury, ER, ICU, a nurse, travel nurse during COVID. Been nursing for 6 years.
So you got some stories. Okay, we get back to that.
Mark, Emory, MN, MSN programs, nurse and nurse practitioner program right now. I'm in the nurse practitioner part. So just not working right now, but just pretty much just doing the, school thing. So
Okay.
Cool. My name is Michael Curtis Jr. I go by MJ, originally from South Memphis. Graduated with a Bachelor of Science in Nursing from the University of Tennessee, Knoxville. Went back, worked in the emergency department for about 1.5 years at Regional 1, Level 1 Trauma Center. Transitioned to the Trauma Intensive Care Unit for another 1.5 years while working per diem in the emergency department. Now back enrolled in school, continuing education.
Came back for more pain, man?
I came back, man, for more pain so I could take the pain away with nurse anesthesia. So I'm enrolled in the nurse anesthesia program at Emory University.
Okay, represent. Okay. Well, fellas, first and foremost, thanks for your time. It's the most valuable asset we got, so thank you. So let's get right to it. So when to go into some of the pros, right? Everybody's been in nursing right now or nursing school even. So what do you think as your years in nursing school or nursing, some of the pros being a male specifically?
That's a really good question.
Yeah.
That's a really good question. It takes some. I think in retrospect, you will have a better perspective out of it. So when I was at the University of Tennessee, Knoxville, that's a predominantly white institution.
Okay,
and I was the only black male nurse. It was about three other black nurses, but I was the only black male nurse there. So the experience being in nursing school. I would say I really didn't see that big of a difference, except for I just wasn't included mostly in like the in crowds because of, I'm a male and also I was black.
Right.
So I wasn't included as much, but I think that I decided I didn't take a victim mentality of it. So like I would say I was ignorant to it. And so I just knew I was there for a degree. In order to excel so I can really impact somebody's life.
Right.
But in retrospect, like I said, you can see so many things more differently. I think the main thing will probably be just not being included as much in those intimate conversations like about test assignments and such like that. And
especially being the only black. You said there's only two other blacks at all? And
Yep.
the only black male?
Yep. And then actually one of them dropped out second year. So and it's
So you really was like on the island?
Yeah, it was myself and this other young lady named LaJerica, and she's actually a nurse practitioner now. Congratulations, LaJerica. But yeah, it was only us, and like you said, it was just like an island. So, but it kind of prepares you for the professional terrain as well, depending on where you work. But it kind of prepares you for what you're going to get into. But like I said, I'm so much on not taking a victim mentality because, if you start to see, I'm alone, you start to focus on that, then you actually will feel alone for real. And you start to focus on that instead of actually focus on executing and excelling.
What you're there for, pretty much.
Yep. But so yeah, my experience in nursing school, and also the last thing I'll say about that, I was so much more concerned about making the experience better for other black folks in nursing and outside of nursing.
Right.
During my experience in undergrad, especially when it came to my extracurricular. So I think my purpose kind of protected me from those negative feelings I could have experienced by being in nursing. Like my eyes were lifted more so to the hills instead of like trying to focus on like, I guess, why I'm not being included, why people don't like me, or is this a racism type deal?
And it's easy to get caught up in that too, especially at a certain institution you at or whether the hospital you at. I know, Mark, we both in nursing school at Emory.
yeah.
How did you feel? Because I think in my class, I was the only black male. What about you?
Yeah, so I'm the only black male in the MSN program. To be honest, I was okay. I mean, growing up, so kind of just backstory. I grew up in like Chicagoland area, and mainly in the suburbs. I was used to being the only black guy. You know what I mean? And in school, high school, I mean, there was a couple black people, but really the minority. So like moving to Atlanta, I moved to Atlanta like 5 years ago. I mean, it felt very comfortable here.
Yeah,
so,
that's good.
You know what I mean? So I actually have like a different perspective. And then going to Emory, being the only black male, but I mean, there was still a decent amount of just, black women, but there was black, you know what I mean? It was,
of course,
a decent amount of black people. So I was comfortable.
That's good. Even minorities, Indian, black, whatever it was.
Right.
Yeah.
And that's what I mean. But yeah, I mean, so I enjoyed it. I was able to make friends. You know what I mean? We met. I remember we met.
Yeah. I mean, at that time we was only. I think it was like orientation.
It was like an orientation. Yeah.
And black just gravitate sometimes toward each other.
Definitely
familiar face.
I mean, yeah. So that's how we met. But what about your experience, Tim?
It was about the same. We were starting nursing school only. So I went to Albany State. So we were at HBCU.
Okay.
I went after my first degree. And so when I started the program, I was the only male in there. We had a class of about 16, 17. And by the time I graduated, I was the only person from that class that even graduated.
What?
Yeah, I was. I was. And so I had caught up with other students who were waiting their turn to start back in the program.
Yeah.
So at the end, it was like probably like 8 of us in the class. And so the experience was, one, it was like a thirst for knowledge. So it was always focused on just getting to the goal.
Yeah.
So learning was fun. The experiments were fun. Pursuing like nursing and practicing what you're learning and then applying it, openly without fear of messing up, I guess you could say.
Right.
Yeah. It was very fulfilling. The professors connected a lot. So because it was an HBCU, it definitely felt like Atlanta, right? It felt like it was a black community. Yeah. So it allowed us to connect based off of our culture, how we are. And so we could learn that way, which is more beneficial.
Okay.
Then got to, and so it's like you're on an island by yourself because you're still the only male there.
Yeah.
But, I was definitely fortunate that my class, they supported and they kept me together. They want
to see you succeed. You're the only male. They want to make sure you succeed. I got that experience. Emory, you're the only male. And I guess
nurture you.
Right, exactly. So
I was actually thinking the same thing. Go ahead.
Yeah. No, go ahead.
No, I was just gonna say, I felt very nurtured. I feel like there was honestly an advantage being a black male. Surrounded by that type of environment. Because they want to see you succeed.
Exactly. Yeah. Did you find that you had any situations that you kind of had to, in nursing school or in the hospital, you had to tiptoe and watch how you talk because you're a male and you don't want it to come off a certain way? Because I think there's a double standard in nursing, right? So whether, nurses can get away with saying certain things, females, right? See, right. So, but if a male does it, it's wild. So I remember I had this was a patient where, my externship, I had one of my jobs was to roll a patient out after surgery, whatever, right? So it was a patient and her sister. So I roll her out and, she tries to tip me. She gives me like a $10 bill. And I remember thinking,
that's crazy.
I ain't seen a $10 bill in so long.
That's crazy.
So I'm like, no, it's okay. It's part of my job, this and that. He's like, oh, okay. No, you're good. Have a good day. Happy recovery. So as I'm turning around, she gets in the car, rolls her window down and says, I want to take you home. I'm like, it's going to cost more than $10. And then I went in and I told the nurse, the story, right? So I had to get something for the patient she was working. So as I leave, she's like, when you come back, I'm going to give you a tip. I'm like, really? That's what we doing?
The nurse said that.
The nurse said that.
Yeah, it is kind of crazy.
The nurse said that, but have you found yourself in those kind of situations where you had to tiptoe pretty much and be aware of your surroundings and what you say?
I got you.
Mm-hmm.
Yeah, that's. I would say I had an experience similar to what you experienced.
Mm-hmm.
But when it came to tiptoeing around, like what I said, I think in the unit that I worked at, I didn't have to tiptoe around because a lot of people. Well, I worked in an all black emergency department, and so they really respected the male perspective.
Okay,
so it's more so. In a sense, whatever, I guess a black male would say, it's kind of like they would listen to it and they'll try to yield to it. But with the patients, I did have an experience like that where I came in with a sickle cell patient, doing what I can, giving the morphine, the fluids, all the things. And then I saw her phone go up a little bit. And I'm just like, okay, you know, I'm used to patients being on the phone, not really being interacting with their care. Cool, it's no problem. I'm gonna do what I got to do, and I'm gonna get out, let you heal up. So then I come back and we're talking. She started to flirt with me, of course, professionally. I'm like, this ain't it. This ain't that. Like, no, you know. And then I do the little. I don't really say nothing, but I'm like, cool. She leaves. Another patient come in, a part of the sickle cell community. They're very tight in Memphis.
Okay.
And then shows me a picture on Facebook of me, the first lady who came in and took a picture of me, and she showed me a picture and said, "You got some eyes on you." She put me on Facebook.
Wow.
And was like, "Look at my male nurse. He's so cute. Oh my God, all the things." I'm just like, that's kind of crazy. That's crazy. That's really crazy. But I would say the difference with that is, I think when young ladies or females speak out about that experience, it'll be taken more seriously.
For sure.
But when it's like a male speaking out about the experience, it's like, come on, man, like you straight.
Yeah.
Like that's kind of what it is, you know? Because I could imagine if that would have happened to a black female, especially in that unit, they probably would have been like, all right, that patient's not gonna get any female nurses, only male nurses, sure. And then making sure like they keep eyes on it. But when I told them about it, it was a joke. You know, it was right. Funny. And I won't lie, even on my end, I mean, I didn't think really much of it because, of course, I can hold my own. I'm a young man at that time, and so I didn't take it seriously. I wasn't trying to push it either. But when it comes to like talking, I think I don't think I had to really think too much about it, especially just being in the unit. I think it's really unit dependent, though. I think it's really unit dependent.
Because I don't know where
units have
all
cultures.
kind of crap.
Yeah, that's really
cultures.
good. Yeah, and then where you fit in. Like I said, I was the only black male nurse, and then having like other younger female nurses, and then being a charge nurse at one point. Really, it's like kind of what I said. Like they trusted me at one point. You know, they really trusted me, and they confided in me, and they knew I knew what was best. So what I said kind of they yielded to and they respected.
Held some weight. Okay. That's good. Anybody else want
to? I had a different perspective. It's like, so I went to HBCU. So it was a black school. So we were, common community. Mm-hmm. So our communication styles were pretty common, similar, right? Yeah. So then I think I had a culture shock actually when I moved to Atlanta and started my first job.
Okay.
And so now I'm in the ER, and I'm at, downtown. But so the communication styles, it was like it switched. So the way we used to communicate, back in school in my class, it was totally different now that we've had mostly a white staff.
Right?
Yeah.
And so the way I would communicate then, it was not the way we could communicate here. So it's like noticing it was like, one, your voice was quieted. Like you were silenced by your voice because it was too aggressive, too much, too whatever the opinions that came out of it.
Right.
You can say the same thing, but it's because you said it and versus not them. It went over differently. I think and so noticing it was like what I observed was like, blacks were just silenced and they didn't have leadership positions and they didn't feel welcome to have leadership positions because they did not fit in that community. So the community that dominated the ER, they stuck together. And then like the other black community, they went to nights or they still stuck to themselves.
That's true.
So blacks were on nights, or you may have one or two that were on day shift. And then so it was just noticing just like the cultural differences.
Yeah.
Even just by shift.
By shift, yeah. By shift, it was everybody had like it was just different. So if you could code switch better, then you were black on day shift. Yeah. If you couldn't code shift, then you were on nights because it was more comfortable.
Mm-hmm. I see what you're saying. And to that point, I think about the emergency department then when I worked in trauma intensive care. Trauma intensive care is predominantly white. Yeah. So I can go down to the ER and man, I'll be like, hey, what's up, homie? I'm talking about, and then we got right with patients real quick. Like, what I'm talking about? Like you get right with them.
Right.
But in trauma intensive care, you had to talk a little differently. You had to speak a little differently. And so to your point, now that I think about it, I actually could not say as much as I wanted to say over there in trauma intensive care especially if I felt like I was been a little slighted or wrong based on assignment or speaking to a physician, I remember it was a time where a physician actually spoke to me like I was a kid, and I'm 24, and they were like 26 resident. Spoke to me like I was a kid, and I was on night shift. You know what I'm talking about? So
how do you handle that? Like, how do you handle the situation though?
Man, so I think it's picking your battles. I think it's picking your battles and reading the room.
Okay.
So I would say if it's a cold situation, you're coding a patient, and you're doing chest compressions, but they're not deep enough, and your attending screams, you need to do it better. If you can't do it, get out the way. Read the room, right? So at that point, you take that criticism, although it's not as constructive,
right?
But it's a life on the line. So I'm going to push harder, or I'm going to get out the way, right? So you got to read the room versus it's not an emergency. It's a very calm environment. And then now I just feel like you're just challenging my man,
right?
Or challenging me as a person, right? I always say you can say the same thing two different ways. You can say, dang, your mama just died yesterday, which is crazy. Or, hey, your mama passed, and I really feel sorry about it. Two different ways to say things.
Right.
And so I'll say to that point, reading the room is so much more important. But if you do feel disrespected, definitely don't call it out in that situation because it's all about the patient first.
Exactly.
After that, then you go to the person and speak to them. Hey, I didn't like how the way you chatted with me in there. I would appreciate if you could speak to me in a more respectable tone. And then depending on how that goes, that's where if you have to elevate to a superior, or maybe, you can come to some type of conclusion. But I definitely will disagree. Now, I will say I used to do that. Sometimes in the moment, and when a patient's right there, and if I feel disrespected,
it's hard to turn that
say
off,
something back.
Right? It's it's hard to turn off, but you will say something back.
Yeah.
But the way you said it is the right way to do it. Take it offline because the patient is the main reason you're there. So so we're gonna switch gears a little bit. Nursing itself. Have you gotten any pushback on going into nursing at all from your friends or your family? Did they ask like, why are you going to nursing? Why you a dude? Why don't you be a doctor or something like that?
I mean, I'll start off. I honestly did not really get any pushback, but at the same time, I mean, like, most of my family is just, they're female. My mom's an LPN.
Okay.
I have several aunts, that are like a nurse or some type of like, healthcare capacity. So I really didn't like get too much pushback when they heard. They're like, oh, like welcome, not really welcome to the family. You know what I mean?
Yeah.
So yeah, I mean, with my experience, I mean, yeah,
it was all up.
It was all good. Yeah.
Okay.
Yeah, pretty much.
That's good. I mean, I had the same kind of experience. Like people was like, I was expecting, I guess, to get, like a doctor or something.
Yeah.
I was like, nah, I kind of enjoy, being a little bit more hands-on. Actually, not that doctors aren't.
You're right.
But this is what works for me. And to your point, like my mother, she was a nurse for 30 years, but she was a psych nurse, so she got all kinds of stories.
Yeah,
but,
definitely.
Oh my God, she got all kinds of stories. But she was like, oh my God, I can't believe you're doing this. Like, I was like, man, I should have been doing this a long time ago.
But I don't think people really realize like what nurses do. Like if you're outside looking in, they don't know
There's
like what school
units,
is like.
Right.
And that's what I'm saying. Like they just see you as the person that's coming in that's saying, are you okay? And then gives you medications and you know what I mean? So that's why I feel like that's a lot of the reason why, you know what I mean?
Because they don't understand what it entails.
Exactly. It's a lot,
I think it's like different, like I guess it's all code. Like ER, it's like a lot of men in the ER because it's just it's more of an aggressive environment. It's more of like
true.
You can do your own thing and assert yourself and help out the most. It's like I guess it's kind of like the craziest part of the entire hospital. So that's where men kind of feel like it's kind of like a superhero. Right?
Exactly.
Like when you're in the ER, it's like this is like superhero. It's like it's cool. It's like I'm not asking everybody what they want medications. I'm actually doing life-saving measures, asserting my knowledge and ability and tussling with psych patients.
That's
like
real.
You come in, so it's like you're like a little superhero a little bit, like, and then also being black in the ER, though, like this has happened a couple times where the black card gets pulled, right? So it's like you got black guy going crazy, psych, and then, white people or whatever just kind of observing it. They call the black man to come take care of the black man.
That's happening,
boy. A lot of times, like a lot of times, And so, it's kind of like it's kind of a it's an interesting dynamic, but they definitely sometimes refer like let me get the strong black guy to go take care of, the situation, whatever it may be.
Yeah, that's real.
I think when I was at doing my clinical rotation, I got the most, I didn't expect it, but patients themselves was like giving me more encouragement, especially when I saw black males. They're like, oh, you went to school? Yeah. Oh, man, I would just sit for them for like 15 minutes and just talk, and it was like really encouraging. Yeah. And that surprised me that they really was like, we need more male nurses. I had no idea, so I got into nursing school.
Yeah. My experience actually was different. When I actually got off the unit, when I got out of school and got on the unit, I took it seriously. Like I knew exactly that I wanted to be intentional with taking care of patients and really make a difference. So I did everything that I could, like full assessments and checking in on patients every 5 minutes, vital signs, make sure they're straight, advocating for them. And so when I used to walk in the room, and based on kind of how I approached it, they would say, "Are you the doctor?" I got that so much, man. So much.
I did too,
Right? Like, hey, you listen to my heart and my lungs sounds. Nobody done that before. Nobody ever, put a stethoscope on my chest. And so they would ask me, "Am I the doctor?" And so then, of course, I would say no. So then the conversation would be, "Well, you should go back to school and be a doctor." And I'm like, you don't even understand that route. Like, that's like 20 more years of school. Like, I'm not trying to do that's more money. You know what I'm talking about? So wasn't trying to do that. But I got that a lot. So much just based on how the way I just presented myself in there. And then even outside of school, like whenever I go to a coffee shop or I'm studying or I'm on the phone with somebody over here, they'll think I'm a doctor. So then the conversation will always shift to that.
Really?
And it was, I would say at one point it got really discouraging because I'm just like, man, like, will I only get the respect from people if I'm a doctor? Ooh, another thing that they'll do, you come into the room, "Hey, my name is Michael. I'll be taking care of you. I'm your nurse. So where's the doctor?" And you'll get into that in the emergency department too. So I'm like, man, will I only have respect because most of men, like, I feel like that's what men want. Like that's our transaction is respect. Like, will I really get that respect in this profession if I'm a nurse? And so then I was toying with that idea. So and it kind of got me down at one point. Because it happened so much. So then I did find a route where I could gain more autonomy, which is nurse anesthesia. And so then getting back, and then even still walking into a patient room, "Are you the doctor?" I'm like, and then in the hospital, you can't say that you're a doctor, although you have a doctoral degree. Legally, you can't say, or you have to disclose you're a nurse anesthetist, which is no issue. But I remember this one time, this lady, she did the same thing. She was like, "Hey, are you a doctor?" And I was like, no, I'm not. Again, getting down, I'm like, oh, here we go again.
Yeah.
She was like, "Well, you made the right decision." I swear. And that was the first time anybody's ever said that. And I was, again, toying with that idea. And she was like, "You're going to come out with way much less, you're going to come out less debt. You're going to have a better quality of life. And you're going to be able to go home and see your family at night." And I was like, dang.
She hit on everything.
Yeah. And when I thought about it, that's actually true. And so she spoke life into me, and I'm glad that God put her in my pathway because I knew I was making the right decision. I just need somebody to tell me I was making the right decision.
You need to hear it.
Yeah. And so God put her right there at that printer when I was printing off my material to study. And so ever since then, man, I was like, yeah, I'm going to walk in this purpose, and I'm not going to let other people's idea of me define the respect that I give myself and define who I will be moving forward.
Absolutely. That's a good point. Yeah. Definitely, I like that, man. Speaking of males in nursing, this is a female-dominated area. I think statistics are only 9.4 are male, right? And then 6.7% are African American. Of that 6.7%, 0.67 are Black males.
That boy got the statistics.
Yeah.
It's finance in my other degree.
Yes, sir.
0.67%. So how does that make you feel? Because I remember I didn't know it was that low. I was trying to search on Google. It's like, we can't even find it. Oh, it's actually 0.67% are Black males.
0.67%.
I thought it was at least 2%.
So like out of 100,
it's
not even a whole one.
Not even. You need 200 to make a whole 1.5. So how does that make you feel when you hear that statistic, though?
That's how it feels. You're reminded every time you walk into an environment.
Yeah.
No matter where you go, whether you go California, any place you go, if you see a Black male nurse, it's like, hey, it's maybe one, maybe two, maybe three. Now you're pushing it.
Yeah.
You get used to walking in there alone, but you walk in confidently.
Right.
Definitely.
I definitely think it's a confidence that walks in as well, because you're always used to walking alone.
Yeah. Honestly, like, when I think about it, so I know, when we talk about the patients and who we're seeing, who's sick, I mean, predominantly is Black people, right? Like they're probably going to have the comorbidities. They're
Especially
probably
Black
gonna
men,
have,
right?
And, I think of that, and I think of like, definitely there needs to be more representation. And then I also think about, I feel like it's like a big thing right now, DEI, diversity.
Can you explain that
equity.
for people who don't know?
So DEI, diversity, equity, inclusion. So it's basically like, these companies are trying to implement that so they can get pretty much like more, funding for more, African Americans or, who have you to, be part of their company. So it looks,
Got you.
So there's like back and forth with it. I'm for it, to be honest. But I mean, like I said, I think there needs to be a big representation. Because we're seeing us, you know what I mean, that's sick and in the hospital beds and things like that, so.
Yeah, we're the sickest out of all races, the Black male.
Right.
Yeah.
And I think that's what makes our position important, because if you see more of us, that will maybe translate into less of us getting these extreme illnesses or not, maybe they'll listen to them, hey, you need to eat this versus a female. Not saying it's right, but maybe they'll take more to it.
That's true.
Yeah. I mean, it's just our culture too. You know what I mean? Like, we understand that. Like, when somebody comes in, to be honest, like, a physician of another race may still not understand, like, why are you still eating bread? Why are you know what I mean? You got diabetes. I feel like there's just that comfort of knowing that somebody has the same experiences and eating the same foods and all of that. It makes a huge difference.
One of the things you hit on earlier is about how you carry yourself.
Yeah.
And it transcends, like, think that you are, quote, a higher position than what you are.
Right.
Also, one of those things I thought was when you talked about just communication with, your people that look like you, is that, like, in the ER, it is mostly Black people that come into the ER as our patients, like 90%.
Wow.
I don't know if that's an exact number, like,
right.
No, you said
it's most.
Yeah.
But like, we understand us. And so I felt like a lot of times I see patients, getting education from doctors and nurses, they're educating them, with discharge,
instruction.
Yeah. But it didn't look like they were receiving the instruction.
Yep.
It was like more so just routine. And so one of the things that I took pride in was being able to connect with my patients and connect with them from a male standpoint as well.
Yeah.
And I felt like sometimes that gave them I feel like it gave them a little bit more confidence. I think it gave them a little more reassurance.
Definitely.
And a lot of times, a lot of the feedback was always, thank you so much. Nobody's taking the time to explain it.
That's
like
good.
That.
That's good.
And so it's like so it's like I'm able to teach and connect with them to at least give it the best chance of transcending when they get home and taking better care of themselves versus like keeping them on a cycle.
That's
exactly.
Good.
Yeah. I think just on top of that too, I think another thing is there's a lot of distrust, I feel like, among like Black people in healthcare and, certain things with, the past, the Tuskegee experiments and, all of that stuff too. So, I think that's also an important reason why we need, more Black people in general, but Black males and everything to, kind of just to have more trust, you know what I mean, in the healthcare system.
I agree with you on that one. Going towards the end of this good podcast, go around and if you had to talk to a male, give them a couple of reasons why a Black male or a male in general should go into nursing.
Oh, wow. Start over here.
Starting with you.
Why should a Black male go into nursing?
And I can start just to get your thoughts together.
Yeah.
But I mean, you hit it already, right? Like the more we see more of us, the better outcomes we'll have in the long term. I think like my stepfather, if he sees me saying, hey, we have the same background, we eat the same things. If I tell him, you may want to, just take a walk around the block a couple times, during the week, do this, do that, versus him and his mindset may not be receptive when a female tells him that, or when a white male tells him that, or whatever. So I think the more of us get into the field, the healthier we can make our whole culture.
Yeah.
I think that's a benefit right there.
Yeah. I think I got I thought about it just a little bit. I got 3 words I think that will describe it. I think it's the first one is lucrative. The second one is representation. The last one is change. And so lucrative with nursing, you can do anything. And I did not know that. I did not know that. I really thought that when I was getting this degree, I was only going to work in the emergency department and become a nurse practitioner. That's exactly what I thought I was going to do. And that's exactly what I'm not doing right now.
And then you found out you could do all kinds of
stuff. You can be a nurse scientist. And a lot of people don't know about that. And I actually just learned about it. You can be a nurse scientist. You can be a nurse anesthesia, a nurse practitioner. You can work in administration.
Be a flight nurse.
You can do so many things. Travel nurse, so many things. So you can definitely make a good amount of income that can support you, your family, and then others, your community, by going into nursing. And then the next one is representation, kind of similar to what everyone was saying. You know, the more Black male nurses or the more Black folks that get into the nursing or just the medical field, we can take care of us. And like you said, we can speak that language. We can meet people where they are to really transition them and get them out of that hurtful moment. Yeah. And the other part of that, kind of going to the last question just a little bit, I worked in trauma intensive care and it was predominantly white, like I said. So I was the only one, only Black male nurse on there. There was a few other Black females on there. But, I used to hate how they would interact with Black families when they were emotional, right? So sometimes Black people can be a little bit dramatic. I love my Black mamas, but when your baby dying, you sometimes you can't control yourself. The first thing they want to do is call security. So you making this experience with this Black woman who is losing her little baby boy based on a drive-by, now a police interaction. Instead of put her in a room, talk to her, hug her, control her, make sure she don't hurt herself, but let her express herself. Right. So representation is so important. And then the last one is change. With just being lucrative and then representation overall, you can change the generational gap. You can change the generational prosperity for your family and other people by you being successful, by you showing up into a patient's room, by you showing up in your scrubs. Yep. Especially with dignity and integrity and some respect. People are gonna look to you. Little kids gonna want to be like you, right? And so now we can then get more folks to believe that college can be an answer. We can begin to let other people know that this is not like that glass ceiling that you see. It's not really it. Throw a rock and hit it and then keep rising. I think I end by saying that seeing is believing and believing is seeing. You have to be able to see yourself in different environments. You also have to be able to believe in yourself as well. So I think those two being lucrative and the representation will lead to that change. And I think it'll keep creating that circle of wealth, the circle of health that we need that's going to transcend even the medical terrain, even nursing.
And you touched on the point, I think, Tim, being lucrative, you took some of your experience and turned that into a whole business, which we'll talk about later. But
I'm going to tune in. I got to hear that one.
But you two guys, what would you say to a young Black male?
Going to college, it's not many degrees that you can actually go for and make the money right out of college that 100%. You can with a nursing degree.
100%.
Very good
and
point.
Then with nursing, then at that point, once you're making the money, just like you said earlier, you can do anything. You can go into finance, science, you can go to medical school, dental school. Nothing stops you. So for nursing, it's marketable. It opens you up to now you're in environments with physicians, you're in environments with higher incomes, professional instruction.
Crossing paths.
You're crossing paths, but you graduate, you're making good money, you can go to school for free. The state will pay for your school, absolutely free. They pay you to go to school.
I was like, what school is that? Boy, I'm in debt.
I'm with him.
WIOA program.
I'm with y'all.
Share that with your people. WIOA program. It's in Georgia.
Okay.
WIOA.
Tap in.
Georgia Workforce Consortium. Essentially, it's a program through the Department of Labor that the Department of Labor pays for any job, any school that is 2 years that graduates you with a job. So nursing, you go to school, it's only 2 years. 2 years undergrad, but then you got 2 years of nursing. Then after that, once you graduate, the Department of Labor wants to know, did you get a job? They're going to check in with you quarterly. All you got to do is say yes, 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 and then that's it. They paid your entire program.
Listen, where was you at 2 years ago?
Man, I ain't lying to you. I'm messed up out here financially.
No, you better be good.
I hope so.
But there are also a few things in life that you have to have representation for.
Yeah.
That everybody's going to come into contact with. And that's going to be finances, your health, and legal. you have to have, so having knowledge in at least one of those categories gives you a different type of strength.
Yeah.
So as a father, you know, in our community, we hear a lot of Black stories about misrepresentation in healthcare and also miseducation from our own families that are like, you know, why you been doing that? My grandma been doing that. My grandma been doing it. You know, like I put grease on my burns. You know,
That's kind of crazy.
That is crazy, actually.
You know, so like even as a father, I have a little boy, and so what nursing has given me is confidence. The healthcare knowledge has given me confidence. My boy had a seizure in May of last year out of nowhere at a barbecue, and so my healthcare knowledge gave me the confidence to take care of him.
Yeah.
He was 1 year old.
Wow.
Having a seizure.
That's wild.
Yeah.
Different.
I can't imagine.
Different. And so healthcare is cool until your loved ones are involved.
Definitely.
But it was like a confidence to take care of him. So it's like that who I love the most, I can take care of them. But there's no position to be in to love somebody and not have the knowledge to take care of them.
That's real.
Yeah.
So
I like that, man.
That is what nursing is for me. That's what it's security for my family beyond just financial. It is, you know, healthcare knowledge. So now people like, hey, you know, this is going on. Can you talk to me about it? And then my parents are like, you know, this is the diagnosis. I'm like, well, where's your discharge documentation? Let's read through it. I know they went over it with you in the hospital. Let's read through it to understand.
That's powerful, man, to have that knowledge to be able to go through that.
For sure.
Man.
Yeah. Man, great answers. I mean, if I was talking to that Black male, I mean, I think I would just say we need you. You know, again, representation, that's been a big theme here. Culture, and just knowing, you know what I mean, that you can relate to a lot of these people, you know what I mean? And it may be, you know, discouraging, or you may, you know, dealing with the pharmacology, the pathology, and all of that.
Talk
you know,
about it.
Man, I mean, just going back, I'm just like, you know,
it's real. PTSD.
But you know, I think just working through it, and then the confidence that you get, and to be able to take care of your family, you know, the things that you can do. You know what I'm saying? Like, so there's just so much. There's so many reasons to do it.
Yeah.
Besides it being the money, it's, you know, it's a reward to be able to, you know, take care of patients. It also gives you a perspective of, you know, I think you were alluding to this earlier, that like I could walk, you know, I could talk, you know what I mean? Just the little things in life you can just appreciate, you know? So yeah, I mean, I'm so happy I got into this. So
See that. I appreciate you guys, man, coming through.
Oh yeah.
Giving me some of your time.
Appreciate it.
Before we get out, if you want to shout out your IG real quick, people get in touch with you with any questions.
Yeah. The Merce developer, the Merce with the M developer. Okay.
Kind of cool.
Big Merce.
67. Big Merce 67.
We're all gonna be Merce.
Right. Hold on.
All right, Mickey Merce. Just kidding. That's not me. For real. Don't follow that. That ain't me. No. But on a real note, Michael Curtis. My Instagram is at Mickey James MICKEY JAMES 3 underscores. Boom boom boom.
Write that down. All right. Of course, you know me, Main_Merce. So that's good.
I gotta get this Merce. I gotta get this Merce. Mickey Merce. I may change.
I like that Mickey Merce.
I kind of thought you were serious.
Yeah, for real.
Fellas, again, thank you to the Ivy League. Again, thanks you guys for tuning in. We'll be in touch. For the next episode, and we out.
That's real.
All right.
Yeah.